The broadcast is now starting. All attendees are in listen-only mode.
Hello and welcome to today's presentation. This time we're focusing on medicine. So if you joined me yesterday for the nursing session, today the focus is on medicine. The nursing session is now available for you to watch through our Facebook page at Official OET. So if you are a doctor, tonight is all about you. If you are one of our other professions, for example, a pharmacist, a physio, a dentist, and so forth, then we have 2 sessions set aside for you, which will be on Thursday and Friday, to manage the fact that there are more of those professions in those sessions. So do come back if you are one of those other professions for your session, which will be on Thursday or Friday. If you are a doctor joining this session and you haven't yet seen the new sample test that I'm going to be using in this session, then I have attached it as a handout for this session. So if you look at the control panel, if you're part of the on the webinar app, one of the buttons in your control panel is for handouts, and you'll see that I've uploaded the sample test for medicine task there, so do check that out. I'm going to be referring to it during the session. I'm also going to be sharing the sample answer live for the medicine test during this session, and we'll be chatting about that for the main part of the session. Now, if you are watching me on the OET Facebook page, hi to you. It's lovely that you're joining us. What we heard from candidates joining us last night was that the experience was actually better if they were able to come into the webinar. So there's still time for you to register and jump into the webinar directly. What candidates were saying was it was a bit difficult to view the case notes because they're quite small, particularly if you're watching it on a mobile phone. So perhaps register now. You can register on a phone to see the webinar in the app, and that is hopefully going to be a better experience for you. So in today's session, as I've mentioned, I'm going to be sharing the sample answer for the new sample test for medicine and talk through what you can learn from using a sample answer when you've written your own letter, as well as to make sure that the letter that you write demonstrates the highest level possible for the 6 assessment criteria. I'm going to start off by asking you a question because I would like to find out how many of you have already written your own sample test for this sample test? How many of you have written your own letter? So the poll is up on the screen now. I'll just give you a few seconds to choose your answer. So interestingly, it's about 50-50 actually. Most, slightly more are saying yes, they have, but it's very close. Just over 50% are saying they have, and the others of you are saying that they haven't. So there's a couple of options for you here. Perhaps this was your intention, that you wanted to come and hear what I have to say about the sample test and the sample answer before you attempted to write your own answer, your own letter, in which case that's fine. Please do stay and listen to this session. However, if you would actually really like to have a go at writing your letter for this sample test without hearing from me the best approach to take, then you might want to come out of the session for now, and you can always watch the recording once you have written your own letter a little bit later on. So you can make that decision now, which is going to be best for you in terms of your progress with OET. So as I've mentioned a couple of times, I'm going to be sharing the sample answer, and I will be sharing it on the screen, but I'll also add it now to the handout box. So in your control panel, you'll see, it will come up in a second, that I've added the sample response for the medicine task, which you can now download to have as your own copy. Maybe refer to if it's a bit clearer for you than looking at it on the screen. But here we are. I'm going to put it on the screen now for everybody to have a look. So first of all, with this sample test, with this letter, I want to have a quick chat about the layout of the letter. So we can see here that the address and the date are in the top left-hand corner of the letter. Now, these can be written in either order. So if you have the date above the address, then that's also acceptable. Underneath this, we have the greeting. And in this case, we've been provided with the doctor's name, Dr. Desai, so we can use that here in this letter. But if you had a task where you haven't been given the doctor's name, just their job title, for example, write to the doctor or write to the consultant, you can also use their job title here in place of their name. We've been given the name, so it's most appropriate to use the name. At the bottom of the letter, we have the ending, yours sincerely, and then your job title as the writer, which is, of course, is doctor here. And then under the greeting, back towards the top of the letter, we have the RE line, which includes the patient's full name and their date of birth. Now, in this sample answer, the two pieces of information have been split onto two lines, which is absolutely fine, but it's also fine and acceptable to write them both on the same line. And we recommend that on the RE line, or if you split it onto two lines, your first choice should be to use the patient's date of birth, because this is something which in real life, obviously the reader could check in their database, whereas the age isn't something that they can particularly look up on their files. So the date of birth would be the first choice to include. If the date of birth isn't, for whatever reason, included in the case notes, then you could include the patient's age. You can also include the patient's age, as you'll see, within the body of the letter. So that's the layout, that's the sort of structure that you should follow. And the sections that are now left, which we're going to talk about in a second, are the body of the letter. And in this sample answer, the paragraphs have been split into 5 paragraphs. I wonder if this is the number of paragraphs that you had in your letter when you wrote it. If the answer to that is no, perhaps you had less or you had more, that isn't necessarily a problem. And we'll come back towards the end of the session to what to do if your letter is quite different from this sample answer and what it means. So let's have a look at the structure of the letter, because it's really important to put yourself in the reader's shoes and to consider how clear have I communicated the information to the reader? How easy is it for them to identify the information that they need to continue caring for the patient? And one of the ways that readers can get a very clear picture of the information is from the way that the letter has been organised. And in this example, I'm going to highlight now the first phrase of each paragraph, which actually explains what is coming next in that paragraph. It's a bit like a topic phrase. And this makes it really clear for the reader to understand how the letter has been organised. We can see that in the main, this letter is using a chronological approach. So the phrases that we've got here are, thank you for seeing Mr. Knowles. Then in the second paragraph, Mr. Knowles has lost 2 kilograms over the last 4 weeks. Then he first presented to me a month ago. Mr. Knowles is usually fit and well, and finally, I would be grateful if you could see Mr. Knowles. So in this letter, we can see that the first paragraph, of course, includes the reason for writing, which is most important to the reader. But then the second paragraph introduces the current situation. Because this is an urgent situation, the reader is going to be most interested to know what has led to this urgent referral. Why is this patient's situation something that they need to focus on straight away? And so as an urgent situation, the second paragraph includes the current situation, the current details. And then after this, the background to the situation is provided. Any relevant history from the patient's previous medical or social history, and finally the next steps, what is required of the reader once they have read the letter. So while the whole paragraph, of course, needs to be clear, making the topic of each paragraph clear from the opening phrase is a good way to score well in organisation and layout, which is one of the assessment criteria we're going to be looking at a little bit later. The key details are at the front of the paragraph, and so they're not getting hidden by less important information. Let's now look at each paragraph in turn and what contents the writer has included. So in paragraph 1, the writer has included the patient's age and previous occupation, as well as a request to the reader for an urgent investigation of his symptoms. So that word urgent is there right at the beginning to make it clear to the reader that this is the situation the patient is in now. Paragraph 2 has included the patient's current symptoms and their blood test results. Paragraph 3 covers the onset of the current condition, as well as the patient's previous medical treatment and additional symptoms that they are now experiencing. Paragraph 4 picks out a few details about the patient's lifestyle, as well as their previous medical history, which is relevant to this situation. And finally, paragraph 5 makes a specific request of the reader about what is required here, as well as the writer's concerns, in this case, what they suspect the condition to be and what they want the reader to ascertain if that is correct. So let's compare this with the case notes. So here the case notes are coming up on their screen. Apologies that they are quite small probably to view. When you look at a set of case notes, of course, as we recommend, the first thing that you should do is check the writing task. What is your reason for writing this letter? And here we can see that you are being asked to write a letter of referral for assessment of this patient. The second place to check is the notes section, which is at the beginning of the letter. What is your role in the patient's care? Because this is going to help you understand whether you have been treating this patient for some time, or as in this case, this is a new patient to your clinic. You've only met them one time before, but the patient has been visiting you at your clinic. And the third piece of information that I would check is the information provided just above the writing task at the end of the case notes, in this case provided in the plan section. This could provide extra details about what will be important for you to include in your letter. And we can see here that it does include some useful information that we're needing to write an urgent referral to the gastroenterologist for assessment and endoscopy, because of your concerns that there could be a pancreatic malignancy, which you have informed to the patient of this possibility. So we want to check our letter, the sample letter, to make sure it has included all of those things. And from what we just discussed, we know that all of those things have been included in paragraphs 1 and 5, or a little bit in both. So that's a really good start when considering our letter. If we look on this slide, where you can see which case notes have been included from the highlights that are appearing, we also want to make sure that this is the information that the reader would need to be able to understand the situation. And we can see here that all of this detail about the most recent visit have been included in either paragraph 2 or paragraph 3, which will enable the reader to understand the current situation and the progress of the case until today. This information on the left-hand side from the first visit to the doctor enables the reader to understand the onset of the situation. And then this information above that on the left-hand side provides the reader with any relevant background for this reader or situation to give them a complete picture of this patient's history and associated risk factors. The other thing to do with the case notes, obviously once you've selected the information, and in this case we're checking that the information that is needed has been included in the sample answer, is then to make sure that nothing has been left out by accident. So keeping those highlights on the page, let's look at what is left, what hasn't been highlighted. So we can see that some details from the patient's social background, for example, their marital status and how they keep active, have been omitted. We can also see that their family history, their childhood illness and their current depression have been omitted because these are not relevant to the current situation. Then we can see that the details at the bottom have been omitted because these have been superseded. So, for example, the patient's concerns about hernia, the fact that a full exam was performed and tests were ordered have been omitted because they have been superseded by the current condition and the fact that the test results have now returned and we're supplying them to the reader. But most of the remaining notes have been included, everything other really than the patient's current weight and that their main concern is their back pain. The rest of the information have all been included due to their relevance. So let's now look again at the sample answer and what we can analyse from it in terms of the language and vocabulary that the writer has used. Because analysing the sample answer is a good way of then testing whether your letter also contains as good an example of language as the sample answer and as the assessor is going to be checking for. So in this sample answer, you can see that we have a mixture of sentence types. I'm just going to pick out 3 different types so that you can have an example of each. So we have a complex sentence, a compound sentence, and we have a simple sentence. So this is natural when we are communicating in English that we will need to use a variety of sentence types. It's not to say that you will need particularly more than one over others or that you have to have at least one example of each in the letter to get a good score. Just that this is natural to communicate an amount of information clearly and concisely to the reader that you will need to use a variety of sentence types to combine and present that information. This letter also includes a good range of tenses, which again, in this case, are appropriate to be able to communicate the different time frames that the situation is referencing, that it is covering. So we have use of the present perfect. Mr. Knowles has lost 2 kilograms over the last 4 weeks. We have past simple. His blood test showed deranged liver function. Present simple, he drinks socially. And we've also got an example of the past perfect here, which has been used in the same sentence as past simple. I'll just highlight that here. He first presented to me a month ago. And then we have the past perfect after that to show that this had taken place at a different past time. So that's a good example of the past perfect being used in that sentence there. We've also got use of passive forms in this example and active forms, which here come at the end of the letter to make the request of the reader. Connectors have been used, particularly simple connectors like and but. We've also got a more complex connector here, the use of despite. But you'll notice that this letter doesn't have many connectors other than that. They've been used minimally to keep the communication clear for the reader, and they haven't just been slotted in there at the start of many sentences, which is actually in some situations a hindrance to the reader, that they have to sort of read extra words to get at the information that they actually want. Some other positives to pick out about this letter is that the letter has used appropriate medical terms to replace the note forms from the case note. So jaundice has been used to replace yellow discoloration of skin and eyes. And the test results have also been presented technically. So, for example, deranged liver function, raised bilirubin, etc. And given that we're writing to a gastroenterologist, the abbreviation of GI at the start of the letter is, in this case, appropriate. The other thing to notice here is that there aren't any use of set phrases. So, for example, there hasn't been use of signs and symptoms in regard to his medical history in light of the above and so forth. Now, I don't want to mislead you, those phrases aren't wrong, but this is a good example of a letter which is very clear without needing any of those phrases. And a lot of candidates are getting into the habit of adding these sort of set phrases, as we call them, into every letter that they write when they aren't always needed, or the letter would be clearer without them. You should be thinking about whether the phrase that you're adding is making things clearer or providing the reader with unnecessary additional words to read because it's not actually essential information. So that's a good thing to consider and balance. So when we think about how the letter has evidenced the assessment criteria, it's good to have a copy of the descriptors in front of us. And you'll see from this slide now showing on the screen that there's a link at the top of the slide to where you will find the descriptors on the OET website. And this is something I really recommend you download. You stick to the wall where you do your study, or you print off and you keep it somewhere with your practice materials and so forth. You should be looking at this very regularly and using the assessment descriptors to analyze your writing, understand what it is that the assessors are looking for, and how well you are evidencing this whenever you do a piece of writing. And we recommend that you always aim for the highest level available rather than settling for the minimum you might need just to get the score that is required for your registration purposes. Of course, if you aim high and fall a little short, you should still end up with the result that you want. And we're not suggesting that you need to be perfect. Even candidates aiming for an A grade do not need to get everything in these highest bands to end up with an A grade. There can still be mistakes in their writing. But if you're aiming for the highest, as I said, but fall a little bit short, then there's no damage done there. You're still improving your writing to a very high level. And by falling slightly short of that, you will then feel confident to be able to get the grade that you want on test day. So let's look at the letter and how it has evidenced each of these criteria in turn. So the first assessment criteria is purpose, whether the reason for writing is immediately apparent and sufficiently expanded during the letter. And we can see that the first paragraph includes a very clear reason for writing, so the urgent investigation of his upper GI, and that this is explained over the course of the next 3 paragraphs and revisited in the final paragraph with more specific details requesting the endoscopy. So this purpose is very clear and has done a good job. Content is the next assessment criteria, and this is addressing what is needed to continue care and accurately represent the case notes. So as an example, in the second paragraph, we can see the patient's current condition and test results, and that these are being copied correctly. Similarly, details from the patient's first visit are included in paragraph 3, and they've been correctly copied, including the medication prescribed at that time. The third assessment criteria is conciseness and clarity, and this is judging whether the information has been summarized effectively and presented clearly. And we can see that as an example in paragraph 3, the details of the first visit have been summarized clearly into 2 sentences. And as we've already discussed, details about the patient's history of depression, their family medical history, and details from the first visit, which have now been superseded, have been correctly omitted to avoid giving the reader irrelevant detail. The fourth assessment criteria is genre and style, and this is checking whether your writing is clinical and factual and uses language which is appropriate for this document of a formal letter. So as previously discussed, the letter includes technical terms and which are appropriate for the reader and further summarize the case criteria is this example from paragraph 4, and this is checking whether your writing is clinical and factual and uses presentation of the information about the patient's lifestyle. So as previously discussed, as we discussed earlier, the only abbreviation used is appropriate to this reader, and brackets have also been used minimally but appropriately, simply to record the medication prescribed. So there's no reduction in formality overall. The next assessment criteria is organisation and layout, and we focused on this at the start of the session. It's checking whether the letter is logical and clear and whether the key information has been highlighted. And we can see that this letter includes time references, words like today, a month ago, and so forth, which mean that it's helpful for the reader to understand what is happening when. The letter is logical and clear. And as previously discussed, there is a clear theme to each of the paragraphs, which makes the letter easy to follow and understand. And the final assessment criteria is language. This is checking whether your spelling, your grammar, your punctuation, your vocabulary and sentence structure are accurate. And as would be expected from a sample answer provided by OET, the language features in this sample answer are all completely accurate. Additionally, language has been used flexibly, as we've seen, through the variety of sentence type and tenses, which have been used to clearly communicate the information to the reader. So having looked in some detail at this sample answer, I want to ask you another question. I want to find out from you how similar or not this sample answer is to your letter. If you've already written one for yourself using the test, whether your response is almost the same, quite similar, or quite different. Okay, so most of you are saying your letter is quite similar, which is good news. Some are even saying that your letter is almost the same as this one. Some of you are saying that your letter is quite different. So let's just talk a little bit about what to do if when you do a practice test, your answer is not the same as the sample one provided, particularly if it's an official task provided by OET. So what are some things that you can do after you have written your answer? So the things that you want to do are to make sure that your letter is as good as the sample answer. Sample answers are just one way to write a letter for these case notes. There's more than one way, and certainly when I sit down to prepare for something like tonight, I write my own sample answer for the case notes without looking at the official one first, and then I compare it to see how similar or different that they are. And so I will often see that it's possible to present the same information slightly differently, perhaps using the same organization and layout, but using slightly different phrases or using different combinations of case notes together. So those of you who answered that your letter was quite similar or perhaps even quite different may still have written a good letter, provided that you have evidenced all the assessment criteria equally well to the sample answer here. The problem could be, for example, if you've missed out information or you've included information that wasn't in this sample, then you might lose marks either for content or conciseness and clarity because you've included details that were perhaps irrelevant or you haven't included information that was important for the reader to be able to continue caring for the patient. Similarly, if the accuracy of your language and sentence construction is not so good, then you will find that your score for language is affected, but potentially not enough to impact the overall grade that you're aiming for. And these are all things that you can work on, and I can give you some more suggestions on how you can do that. So there are also improvements, as I've sort of mentioning, that you could make even to this sample answer. As I've said, this sample answer isn't supposed to be perfect. Alternative sentence structures are possible. Perhaps things like including the specific date of the first consultation would have been handy and made it a bit clearer for the reader to get a sense of the timeline. So improvements are possible without sort of overall changing the main contents that have been included in the letter. Now, over 200 of you submitted your letter through our link, which is great, and thank you so much for doing that. I'm not going to be able to talk about many of those letters in the next part of the session, and the letters that I do comment about, I'm only going to be able to give very small comment on because of the time that we have available and the number that I have included. It is of real benefit, though, to get some feedback on your writing. And so I would recommend talking to one of our premium providers. The All-Stars that you've been working with in the last few weeks with our free content every day are all premium providers, and many of them offer writing correction and feedback. So use the link that is on the screen now to contact one or more of those providers, discuss with them your requirements for feedback. And as well as giving you that feedback, they are also able to explain your strengths and weaknesses when it comes to writing and devise a study plan to help you to improve going forward. So one last thing that you can do after this session would be to review your letter against the official sample answer that I've now shared and notice the similarities and differences between the two. As I've mentioned, if your letter is as good as, but slightly different to the official sample answer, then that's fine, that's not a bad thing. But have a look, review your letter and notice, do you now think there's something which is less clear, which you could improve? Check your language and your spelling to make sure it's accurate. Make sure that you have structured the letter to be as clear as possible to the reader. Take some time to make these corrections, to do this analysis of your writing, and then rewrite the letter in perfect English. So when you come back to review and revise from it in the future, you now have your own good example to work from. Okay, so I'm going to move on to just share a few comments and feedback about 10 letters that have been submitted. As I mentioned, over 200 were included, so I can't mention all of them. And as I said, I can only provide some brief feedback to all of those 10 that I am going to mention. But let's have a look. I think it's quite interesting to see different ways of approaching the task, and there are some strengths and some weaknesses in the letters that we did have submitted to us. So the first letter comes from Abdallah, and this letter is structured to suit an urgent situation, and it does have a clear purpose. So he moves straight from the reason for writing to attending the surgery today. But by not mentioning the first visit specifically, this letter does include some inaccuracies for the reader. So for example, when we come to the phrase about the requested blood test, focus on it here, the requested blood tests revealed. We're not sure what those blood tests are because we haven't had information about the first visit as such. We've just seen that the patient attended today with a 4-week history. It's not clear that the patient has visited this doctor prior to now. The second letter comes from Ahmed. And this letter opens with a clear purpose, and dates have been used to provide a clear timeline. But it is quite a wordy letter, and there hasn't been obvious selection of the case notes to include. In fact, most, if not all, of the case notes have been included in the letter, right down to the sort of history of depression, the childhood eczema, and so forth. And that information is considered unnecessary to the reader and would affect the score for conciseness and clarity. Iman is next. The reader would be informed of much of the important information after reading, but what I did find with the majority of samples that were submitted for me to review is that most doctors are not structuring their letter in order of importance to the reader, and certainly not for an emergency situation or an urgent situation like this letter is. So most of you are going from the first visit to the doctor and leaving the current situation until the end. And so for the reader, this is actually the opposite in terms of clarity that they are looking for. They would want to know what has led to this urgent referral to them today before they understand the background of the situation. There are a few language inaccuracies in this letter as well, which also cause a bit of difficulty for the reader. The next letter comes from Aham. This letter does a good job of selecting the relevant information, and it has been included in an organised way, so case notes have been combined together in a sensible order. But again, the structure means that the reader has to search for the information that is most important to them. The test results are perhaps over-summarised here as well, so only his LTF is deranged has been mentioned without any other reference to any of the other test results that were provided in the case notes. The next sample comes from Tet. The purpose of this letter is clear, and it has been expanded with details from the case notes during the letter. But again, the reader has to search for the information that they would find most important. And some unnecessary details have been included, for example, around the patient's depression, which would again impact this score for conciseness and clarity. Narayan's letter is next. Again, we've got a nice clear purpose to this letter, and the use of dates, particularly the actual dates, helps provide the reader with a clear timeline. Perhaps by placing today's information ahead of the first visit would then have enabled some of that unnecessary details to have been omitted. For example, the patient's concern that they have a hernia. That could have been solved by putting today ahead of the first visit, because the hernia concerns are obviously now superseded. Some sentences could also do with editing to make them clearer for the reader. So, for example, in paragraph 2, there's a very long sentence that combines too many ideas really to be clear for the reader. And so editing that into 2 sentences would probably make it easier and clearer for the reader to understand. The next letter comes from Yin Miat. The purpose here is reasonably clear, but I would recommend that adding urgent would be helpful. All the details such as the medication dosages and dates have been copied clearly. Placing the social details and the details about the depression ahead of the details linked to the symptoms is going to be frustrating for this reader. They will wonder why in an emergency, urgent situation, they are hearing about the patient's lifestyle factors prior to being given details that they're really interested in about the current situation and the onset of this for the patient. Shabiba's letter similarly has a clear purpose and use of dates, but this would also benefit from mentioning urgency and structuring the letter to suit the reader. So this was really the overall comment that I was finding from a lot of the letters that I was reviewing, that particularly the structure of this letter hasn't been organised to suit the reader, and that you're forcing the reader to search within the letter to find the information that they want. Tharindra does include the level of urgency within the purpose, but like other letters, the structure is not to the reader's needs in this case. Some language inaccuracies here are causing confusion. So he was prescribed omeprazole and arranged pathology. This is a little bit confusing because we often use repeated auxiliary verb when it can be repeated. This sentence suggests he arranged pathology, or he was arranged pathology, which would be incorrect English, or the patient isn't able to arrange their own pathology. So that inaccuracy does cause a bit of confusion. And the request for advice at the end is not strictly as per the case note. So be careful about that. The case notes ask you to request the doctor provides assessment, and assessment is different to advice. So don't change the purpose of the case notes when writing your letter. And the final letter I'm going to comment on comes from Lorena. Most of the information that the reader needs has been included, and things like dates and medication have been copied accurately. Again, the structure could be better and the level of urgency added. And in this example, some of the sentences are overlong. Too many ideas are being combined into one. So for example, in paragraphs 2 and paragraphs 4, there are some overlong sentences which could do with some editing, perhaps splitting into 2 to make them clearer for the reader to understand. So this just leaves us with about 15 minutes for you to ask me some questions if you have them, perhaps about this task, your sample answer, or this sample answer that we've been looking at together. So if you are in the webinar, you can now ask me a question by typing into the question box, which should be on your control panel. So I'm just going to open those up so I can see questions that are coming through. So if you have a question about this task or the sample answer that I've been sharing, please type them into the comment box, and we've got about 15 minutes for part of the for me to answer those questions. All right, so let's have a look at what's coming through. Okay, so AXA says, how important is it to mention your diagnosis in the introduction? So I would say